Steady red. Hi, I'm Dr. Neil Schultz, and welcome to Viewer Question Week at BeautyRx and Derm TV. And this is the January 2014 edition of BeautyRx Live, where over live streaming video, you get to ask me questions about BeautyRx skincare products and related issues. Of course, the BeautyRx skincare products are the products that have been giving my patients more beautiful, younger, and healthier looking skin for over a decade. They address the ageless issues of color and texture, as well as lines and wrinkles. And they do it by stressing the daily use of 3 essential ingredients: sunscreen, exfoliants, and antioxidants. Since BeautyRx products are now available to the public, not just to people in my practice, BeautyRx Live allows me to answer your questions about these products or any other related skincare issues. So if you have any questions, please go to BeautyRxLive.com and just enter your question in the chat box, and I'll be happy to get to as many questions today as I can. Again, Dr. Neil Schultz, BeautyRx Live, and this is January 2014. So I think that one of the things that has happened in this extreme weather that we've been having, particularly in the northern part of the United States and the Northeast, this extreme cold, there are unfortunately a tremendous number of people suffering cold injuries. And the cold injury, of course, is frostbite, but you probably haven't heard of frost nip. And Sam asked whether or not frostbite is really, really serious. And that's why I want to address this and make sure that you understand that if exposed parts of your skin are starting to hurt in really cold, sub-freezing weather where there's really low wind chills, it's time to take shelter. If you stay out in the cold and actually as your hands or ears or whatever hurts more and more, it means that there's more damage. If the pain then starts to decrease while you're still out, there's a real chance that you're getting worse, not better, because the nerves are being damaged. So that's a sign you really need to get indoors and warm up. But the problem is that so many people think that they should warm up really fast, and they use really hot heat. And that's the sucker bet, because if you use really hot heat, you'll actually compound the injury that the cold has already caused. And even if your injury was reversible at this point, that heat could actually make it irreversible, because in frostbite there's actually damage first to the upper layer of skin, then to the nerves, and if it proceeds, you actually get damage to the muscles and the fat and the bone, and it's just awful because it's permanent death of that tissue. That tissue isn't coming back. So the real key here is in these sub-freezing weathers with these extreme wind chills, be very, very careful to protect all the exposed parts of your skin. And if you're starting to actually have pain from the cold, it's time to get indoors and warm up very gradually. Use gentle warmth gradually. Never use any really, really hot heat. We have a question today from Ashley. Which is the best BeautyRx moisturizer for this cold winter weather? I have combination skin. Ashley, because you have combination skin, of course we don't want to use anything that's too heavy, but I would say to use the Nourishing Moisture Cream. The Soothing Moisture Cream is a little bit heavier than the Nourishing Moisture Cream, but because you have combination skin, which means you have a little bit of extra oil, and despite the dryness of your cheeks, we want to make sure you're not using anything that's comedogenic, nothing that will increase outbreaks or cause clogging. So my best bet would be Nourishing Moisture Cream, and if you felt that that still wasn't giving you sufficient moisturization with reapplication several times a day, then I would go to the Soothing Moisture Cream. Again, this is Dr. Neil Schultz, BeautyRx Live, January 2014. If you have a question, go to BeautyRxLive.com, and please put your question into the chat box, and I'll get to as many questions as I can. Clara asks, can I use a moisturizer and sunscreen? Sure you can. Of course we want you to use sunscreen every day, even in the winter, because the UVA rays that cause premature aging of the skin and skin cancer, they're present the same all year round and all day long. As soon as daylight occurs, those UVA rays are very strong. as opposed to the UVB rays, which you think about burning in summertime. And the UVB rays, well, they're strongest at noontime. UVA rays, they are the same all year long. So you do want to use a sunscreen even in this crazy cold weather. But make sure that your sunscreen goes on first and your moisturizer goes on second. And that moisturizer is particularly important in this brutally cold weather with the very strong, cold, drying winds, because they will strip all the moisture out of your face even after you put your sunscreen on. So do use a moisturizer. Don't be afraid to put it on top of your sunscreen, but remember, it's always sunscreen first. Gina asks, I feel bad for everyone in the cold freeze in the east, but I live in the west. We're just going to make a small adjustment here. I know you talk about changing products for the winter. What if my weather doesn't change? Well, Gina, thanks for your sympathetic comments about what's going on here in the crazy wild east as opposed to the wild west. But if your weather doesn't change, then you don't need a seasonal change in your products, despite the fact you're going by the calendar from one season to the next, whether it's fall to winter, winter to spring. You do not need to change the vehicles of your active ingredients if, in fact, your temperatures and humidity is relatively constant. So that's a really important question. If you have any questions, please go to BeautyRxLive.com and use the chat box. And again, we're going to get to as many of these questions as we can today. It looks like the cold weather is even slowing down the internet. So we're just waiting for the next question. I hope that you remember that when you're protecting your skin in this very cold weather, don't forget about your ears. Don't forget about your lips. A lot of people ignore their lips. Chapstick is really, really important to prevent over-drying of your lips in this very cold, windy weather. And especially the lower lip. Make sure that chapstick has an SPF in it because you do want to make sure that you're protecting the lower lip from UV because the lower lip is more horizontal and, of course, more susceptible to light rays. Barbara asks, what percent glycolic should I use as a starter product? Barbara, that's a very important question because it took me many years of research to determine what was the lowest strength that would be effective without being irritating. Because for glycolic to work, it can't be irritating, because if it's irritating, obviously you're not going to use it. And it took me a long time to sort of crack the code for gentle but extremely effective exfoliation. So I would start with an 8% product. A serum for oily, acne-prone skin or combination skin, and a cream for normal skin or dry skin. But I would start with 8%. And I think it's important after using glycolic for 2 or 3 or 4 weeks to actually then increase your strength as you're adapting your skin to it. So you're sort of training your skin to receive the glycolic and to respond to it. I would then go to a 10% product and maybe even on alternating nights at the beginning just for the adaptation. And after a few more weeks, then I would probably replace the 8% product with a 15% product and then continue by alternating the 15% with the 10% product. And I'll bet that within 6 weeks, you'll see younger looking skin. Wendy asks, what do you recommend as a basic skincare regimen? Wendy, there are 3 essential products that you need in terms of actives. You need a sunscreen, of course, because we want to prevent future damage. We want to prevent photoaging and skin cancer. But we also want to help to reverse what's already happened. So we want to use an exfoliant, and as you well know, I believe that chemical exfoliants are far superior to physical exfoliants, and that the gold standard of chemical exfoliants is glycolic acid. And I think it's also important to use an antioxidant every day, and I like vitamin C-based antioxidants, which work best when used at bedtime. But these are the actives. You need some infrastructure in your skincare program, which means you need to prepare your skin with a cleanser and a toner. Of course, oil and water skin type appropriate, but with a cleanser and toner each time you put anything on your face, which of course is at least morning and nighttime. So before you put your sunscreen on in the morning, you want to use your cleanser and toner, and before you use your exfoliant and your antioxidant at bedtime, the same thing. The last part of a basic skincare regimen is moisturizer. And in this weather, in the northern United States and northeastern United States, where it's been so cold, moisturizer is mandatory as a protectant on top of your sunscreen in the morning to help protect you from the drying and irritating effects of the cold wind. Moisturizer is also important to help with fine lines and wrinkles, and of course to treat dry skin. So moisturizer would come after your sunscreen in the morning, and moisturizer would come after your glycolic exfoliant and your vitamin C-based antioxidant in the evening. So just to sum this up, infrastructure, cleanser, toner, moisturizer, actives, sunscreen, glycolic exfoliant, and preferably a vitamin C-based antioxidant. Lisa asks, how can I treat wrinkles on my forehead? Lisa, if the wrinkles you're talking about are these horizontal lines, the most effective way to treat them is with Botox. There's no question that Botox will work better than any topical skincare products. And sadly, if your lines and wrinkles on your forehead are medium in depth or deeper than that, there is no skincare product that's going to give you satisfaction. If the horizontal lines are very fine, then you will get improvement from exfoliation, whether it's chemical or physical, and you'll also get some improvement from a moisturizer. But bear in mind that since everybody, I believe, should be using a moisturizer and a glycolic exfoliant to not only treat but help prevent fine lines, if your question really concerns medium and deeper horizontal lines or even frown lines, your best results are going to come from Botox. And while I strongly believe of the importance in the color and texture of your skin, lines and wrinkles do count, and when you have fewer of them and you feel that you look better, you're going to feel better. So by all means, go for it. Lauren asks, what should I look for in a glycolic exfoliant? Lauren, I think that the most important thing that you want to make sure is that the pH of the product is not too low, that it's not too acidic, because it's low pH that drives irritation. When I developed my glycolics, most of the research was done trying to raise the pH so that we would avoid irritation. But when you raise pH, that also, or raise the acidity so that it is less acid. I know it's backwards. The lower the pH, the more irritating and acidic it is, and when you raise the pH, it becomes less irritating and less acidic. So when you go up to this higher, safer, more comfortable pH, you get less of the free acid, which is the active ingredient. So therefore, you then need to raise the percent. That's why BeautyRx glycolics are some of the highest strengths available, because of the higher pH, which allows us to use higher strengths and get higher amounts of the free acid. You also need to make sure that the product is buffered. And my favorite buffering system is ammonia, but there are also sodium buffering systems. And these are all things that you can figure out by looking at the ingredients in the label. And of course, go by brand. Go by a brand name that you know, a brand name that you trust, a brand name with a reputation. Dana asked, I just purchased a few different skincare products. How do I know in which order to apply them? Dana, that question is probably the most confusing issue in all of skincare, whether we're talking about physicians, estheticians, makeup artists, beauty editors, or consumers and users. Very confusing issue. Because it's so confusing, I took the extra step in BeautyRx skincare products to put, since it's BeautyRx, beauty prescription, to put prescription numbers on all the products. So all of my products have a number, and when you're using multiple products from BeautyRx, you always go from the lowest number to the highest number, and you will have no confusion. It'll be very straightforward as to in what order to put your products on. But if your products are not BeautyRx, or not all BeautyRx, and you're using other products, there are two basic principles. Number one, you want to try to put sunscreen on first in the morning. And number two, the order of application really depends on the weight or the vehicle of the product. So something that's very light or in a watery base or in an alcohol base is going to go on first. Something that's in a slightly thicker lotion would go on second. Something in a cream would go on third. Something in a heavier serum would go on next. And something almost like an Aquaphor or something in a petrolatum base would go on last. So you want to ascend in the weight of the vehicles, because the heavier it is, the more apt it is to penetrate a lighter vehicle. But if you put something light on top of something very heavy, it's not going to penetrate, and you're not going to get the benefit. Harriet asks, Dr. Schultz, can you tell me a little more about BeautyRx? A friend uses it, but I'd love to hear about it from you. Harriet, BeautyRx is the skincare line that has evolved over a period of a decade on the basis of the feedback from over 100,000 patient visits in my office, and on the basis also of over 49,000 glycolic treatments. And the basis of BeautyRx is that it addresses the ageless issues of the color of your skin and the texture of your skin, because younger looking skin is all about smoother skin. And in order to have smoother skin, you have to make sure you're removing the dead cells that are there in flakes and mounds, which cause light to be scattered when it hits your skin, instead of to be reflected, which would make your skin look bright and luminous and radiant and much younger. So the BeautyRx has been developed to address these ageless issues that make you look older. See, I really believe that the color and texture are much more aging on your skin than are a few lines and wrinkles, but more about that later. So the BeautyRx has both exfoliants. It also has sunscreens, of course, antioxidants, cleansers, toners, moisturizers, eye creams, hand creams, body lotions, even some hair care products. And I promise you that if you try BeautyRx skincare products, you're going to be a happy camper, because you will see much younger looking, much healthier looking skin. This is our last question for today, and it's a question from Joan. I know it's the winter, but I know sun protection is still important. What type of sun protection should I be pursuing during the winter? And yes, it is Joan. The same sun protection you're going to pursue all year long. Your sun protection in terms of SPF, which is the sun protection factor that protects you from the UVB burning rays, and the UVA protection, or broad spectrum protection, which means the same, that protects you from the UVA rays that cause premature photoaging and also skin cancer. You want to protect yourself the same all year long. The only difference is, in the winter, you may use a different vehicle, a sunscreen in a different vehicle, again, because it's colder and drier. But that would be the only difference. So you want to use something with a minimum SPF of between 15 and 30, and you don't get extra credit for things over 50 and 60 because they do very little additional to help protect you. And you want to make sure that it's labeled either with UVA protection or broad spectrum protection. By the way, the new sunscreen labeling has done away with the term waterproof. There is no longer any claim for waterproof, and if it is water resistant, it's either water resistant for 40 minutes or for 80 minutes, and that's it. And those are the things that you want to look at. But of course, the water resistance is not nearly as important if you're not swimming or engaged in water sports. So I want to thank you all for your questions and your interest, and especially for your questions through Derm TV, which provide the subjects for so many of the different episodes that we do. So please keep sending in your questions. I'll keep trying to do as many episodes as I can about these questions and important skincare issues. And remember, in this cold weather, stay warm and make sure that you're using sunscreen and moisturizer. Dr. Neil Schultz, have a good one.